How does healthcare work in Monkey America? Let's just say it's bananas. One day, a gorilla slips on a banana peel. Classic. She gets a tiny scratch on her paw. Not a big deal. But she panics because she lives in Monkey America. So off she goes to the jungle clinic just to be safe. She checks in and is immediately handed a stack of banana-colored forms. 17 of them. They want to know everything, from what tree she sleeps in to whether she has a nut allergy. She fills them all out, in triplicate, with a crayon tied to a vine. Finally, after 2 hours of jungle waiting room music, a nurse shows up. She smiles sweetly and sticks a tiny bandage on the monkey's paw. That's it. That's the nursing. Then the doctor strolls in, looks at her paw for maybe 12 seconds, says, and disappears into the banana-scented void. 3 days later, surprise, the bill arrives. Total, 800 bananas. Bandage, 200. Pain relief she never got, 300. Doctor's precious 12 seconds, 250. The nurse's emotionally healing smile, 50 more. And no, she didn't even get a banana sticker. Desperate, she tries to use her insurance, but insurance says, oh no, that clinic's out of network. Also, we only cover green bananas on Tuesdays if Mercury is in retrograde. Now she's broke. She owes more bananas than exist in the entire jungle. She thinks about selling her hammock, or her tail. Sitting under a tree, she stares at the bill and mumbles, I should have just licked the paw and moved on. Meanwhile, in Europe, another monkey scratches her paw. She walks into a free clinic, gets treated, gets a pat on the back, and goes home. No forms, no bills, no emotional damage. But in Monkey America, healthcare isn't about healing. It's about turning your banana wound into someone else's vacation home. Sure, her paw gets better, but the debt? That infection never goes away.